As a brain doctor, I must tell you that stroke remains one of the most dangerous threats to older adults, and it often strikes without mercy. The aging process naturally weakens blood vessels, the heart, and the brain, creating the perfect conditions for a sudden attack that can rob you of speech, movement, or even life itself. The reality is that stroke is among the leading causes of death and long-term disability worldwide. And yet so many people ignore the warning signs until it is too late. In the elderly, factors such as hardened arteries, high blood pressure, heart disease, and diabetes silently erode vessel strength every single day. When the blood supply to the brain is blocked or when a weakened artery bursts, brain cells begin to die within minutes. Each second without oxygen increases the damage, and every delay reduces the chance of recovery. Survivors often face paralysis, confusion, loss of vision, or permanent dependence on others. What makes this condition even more alarming is how quickly it can strike: a sudden headache, numbness on one side of the body, or slurred speech may last only moments. Yet these episodes are warnings that a severe stroke may be approaching. Too many dismiss these signals, waiting to see if they pass. But that hesitation can cost a life. The hopeful truth is that there are clear steps you can take to prevent stroke. And knowing how to recognize danger early can save both brain and life. In this video, I will explain the hidden causes, the warning signs, the correct way to respond, and the proven strategies to protect yourself and your loved ones. Before we begin, I want to hear from you. Have you or someone close to you ever experienced sudden dizziness, numbness, or blurred vision that came on without warning? Share your story in the comments below, because your experience may help someone else recognize these early signs and seek help in time. 1. Causes of stroke in the elderly. When we talk about stroke in older adults, it is important to understand that the causes are often a combination of natural aging and underlying health conditions that quietly erode the strength of the blood vessels in the brain. One of the most common and dangerous causes is atherosclerosis, the gradual hardening and narrowing of the arteries over time. Fatty deposits build up along the walls of blood vessels, making them less flexible and reducing the space for blood to flow. As this narrowing progresses, clots can easily form, and when a clot travels to the brain, it blocks circulation and triggers an ischemic stroke. This is why atherosclerosis is sometimes called the silent builder of stroke, because it advances year after year without obvious symptoms until disaster strikes. Another cause that demands attention is vascular malformation in the brain. This condition develops quietly as blood vessels form abnormally, becoming weak and tangled. For years, there may be no signs at all. But when sudden stress, emotional shock, or a spike in blood pressure occurs, one of these fragile vessels can rupture, leading to a hemorrhagic stroke. In many cases, such bleeding in the brain is catastrophic, causing death within hours or leaving survivors with severe disabilities. High blood pressure is perhaps the most significant factor in elderly stroke patients. Constant pressure against artery walls weakens them gradually, making them prone to rupture. At the same time, elevated pressure accelerates the buildup of clots. Older adults with uncontrolled hypertension are estimated to have 3 to 4 times the risk of stroke compared to those with normal blood pressure. It is often called the silent killer because it can damage arteries for years without causing pain. Heart disease also plays a major role. Conditions such as atrial fibrillation, infected heart valves, or tumors inside the heart can release clots that travel directly to the brain. These embolic strokes can occur suddenly, often when a person least expects it. This is why older patients with heart disease require careful monitoring and sometimes lifelong treatment to reduce clot formation. Diabetes is another powerful driver of stroke risk in the elderly. High blood sugar damages blood vessels and accelerates atherosclerosis, creating the perfect environment for clots to develop. Over time, this increases the chance of both ischemic and hemorrhagic stroke. And when combined with hypertension or high cholesterol, the danger multiplies. Lifestyle choices also cannot be ignored. Smoking doubles the risk of stroke by accelerating arterial damage and reducing oxygen supply. Excessive alcohol intake raises blood pressure and weakens vessel walls. Diets high in fat, sugar, and salt contribute to obesity and metabolic disease, further raising the risk. Lack of exercise leaves circulation sluggish and the heart unconditioned, making clots more likely to form. In older adults, these causes rarely exist alone. They combine and reinforce one another. An elderly person with diabetes, hypertension, and high cholesterol who also smokes is facing a storm of risks converging on the brain. Recognizing these causes is the first step toward prevention. Each factor is a warning signal that the brain is under threat. But the hopeful truth is that many of them can be managed or controlled. By addressing these root causes early, older adults can reduce their chances of stroke and preserve both independence and quality of life. 2. Warning signs of stroke in the elderly. One of the most terrifying aspects of stroke is how quickly it can arrive, often in the middle of ordinary activities, without giving the patient or the family time to prepare. Yet, in many cases, the body does send out warning signs, and recognizing these signs in older adults can make the difference between survival with recovery and a life permanently changed by disability. The most common signal is sudden weakness or numbness that affects the face, arm, or leg, usually on one side of the body. A person may suddenly find that they cannot lift an arm, their smile becomes uneven, or their leg drags without control. These changes occur because the part of the brain controlling movement is starved of oxygen. Speech problems are another critical warning. Words may come out slurred. Sentences may be hard to form. Or the individual may have difficulty understanding what others are saying. Sometimes it may sound as if the person is speaking nonsense or mixing words, which can be dismissed as confusion. But in reality, it is a medical emergency. Vision changes also occur suddenly in many strokes. An older adult may complain of blurred vision, double vision, or even a sudden loss of sight in one or both eyes. Because vision problems are common in aging, families sometimes ignore this sign. But when it appears abruptly, it is often the brain crying out for help. Balance and coordination issues are also frequent warnings. A person who was stable minutes before may suddenly become dizzy, unable to walk straight, or collapse without explanation. These episodes can look like weakness from fatigue or dehydration, but they may signal a brain that is not receiving enough blood flow. Headache is another alarming sign, especially when it comes on abruptly and with unusual intensity. A sudden, severe headache that feels different from normal headaches can indicate bleeding in the brain. This type of pain often arrives with nausea, vomiting, or loss of consciousness, and it must never be ignored. In more severe cases, stroke warning signs include sudden incontinence, confusion, or loss of awareness. An elderly person may suddenly appear dazed, unable to respond, or even slip into a coma. These dramatic events reflect major damage already occurring inside the brain. One important condition to understand is the transient ischemic attack, sometimes called a mini stroke. In this situation, symptoms such as numbness, speech difficulty, or vision loss appear, but then disappear within minutes or hours. Too many people dismiss this as nothing serious because the person recovers quickly, but it is actually one of the strongest warnings that a full stroke may follow within days. For older adults, every minute counts. The golden hour, the first 60 minutes after symptoms appear, is the critical window in which emergency treatment can save brain cells. If you notice sudden weakness, slurred speech, blurred vision, or dizziness in a loved one, do not wait to see if it passes. Call emergency services immediately. The faster blood flow is restored, the greater the chance of survival and recovery. Recognizing these signs early and acting without hesitation is one of the most powerful tools to protect seniors from the devastating consequences of stroke. 3. How to respond when stroke symptoms appear. When stroke symptoms strike, every second is critical. The brain cannot survive long without oxygen. And with each passing minute, nearly 2 million brain cells may die. This is why knowing exactly how to respond in the first moments can save a life and prevent permanent disability. The very first rule is to remain calm but act immediately. If you see an older adult suddenly become weak on one side, unable to speak, or lose balance, treat it as a medical emergency without hesitation. Do not wait to see if the symptoms will fade. Even if they improve after a few minutes, the brain has already suffered damage or is at high risk for another more severe attack. Call emergency services right away. Professional medical care in the golden hour. The first 60 minutes after symptom onset can mean the difference between full recovery and lifelong paralysis. While waiting for help, make sure the patient is safe. If they are standing or walking, help them sit or lie down in a safe position to prevent injury from falling. Place them on their side if they are vomiting or appear very drowsy, so their airway remains clear. Keep the surroundings calm, with fresh air available, and never give food, drink, or medication without medical direction. Many people make the mistake of trying to give the patient something to swallow, such as lemon juice, herbal remedies, or even pills they take regularly. This is dangerous. A person experiencing stroke may not be able to swallow safely, and forcing anything into the mouth risks choking or aspiration into the lungs. Similarly, traditional practices such as scraping the skin, pricking fingers to draw blood, or massaging the body do not help and may waste precious time. Another common mistake is to drive the patient yourself to the hospital. Unless emergency services are unavailable, it is far better to wait for trained paramedics who can begin life-saving treatment on the way. If you must transport the patient, do so with them lying down, not sitting upright, to maintain blood flow to the brain. During this time, note the exact time when the first symptoms appeared. Doctors need this information to decide which treatments are possible. For example, clot-busting medication can only be given within a limited window of time, usually a few hours after onset. Without knowing when the symptoms began, this opportunity may be lost. Reassure the patient while waiting for help. Fear and anxiety increase blood pressure and worsen the situation. Speak calmly. Remind them that help is on the way, and focus on keeping them as comfortable as possible. Remember, the response in the first moments does not end with emergency care. Once in the hospital, specialized tests and treatments will determine the best path forward. But your rapid recognition and immediate action are what give the patient that chance. Stroke is a race against time, and the outcome depends heavily on what is done in the very first minutes. Treat every warning sign as urgent. Call for help without delay. And you may save not only a life, but the independence and dignity of someone you love. 4. How to prevent stroke in the elderly. Prevention is the most powerful weapon we have against stroke. And for older adults, it is especially critical because the risk rises sharply with age. The good news is that many of the major risk factors can be managed through consistent care, healthy habits, and timely medical attention. One of the most important steps is controlling blood pressure. Hypertension is called the silent killer because it damages arteries day by day without causing obvious symptoms. Older adults should monitor their blood pressure regularly, follow prescribed medications carefully, and limit salt intake to reduce pressure on vessel walls. Keeping readings below 140 over 90 millimeters of mercury significantly lowers the likelihood of both ischemic and hemorrhagic strokes. Cholesterol management is equally vital. Excess cholesterol builds up inside arteries, forming plaques that narrow the passage of blood. Seniors should have their lipid levels checked at least once or twice a year, aiming to keep low-density lipoprotein, often called bad cholesterol, under control while raising protective high-density lipoprotein. This can be achieved by eating more vegetables, fruits, legumes, and whole grains, while cutting down on fried foods, fatty meats, and processed snacks. Exercise remains a cornerstone of prevention even in advanced age. Gentle, regular activities such as walking, tai chi, yoga, or light aerobic routines improve circulation, strengthen the heart, and help maintain healthy weight. Just 30 minutes of movement on most days is enough to reduce blood pressure, improve balance, and keep arteries flexible. Exercise also sharpens the mind and reduces stress, both of which protect the brain. Lifestyle changes extend beyond diet and exercise. Smoking cessation is non-negotiable. Tobacco doubles the risk of stroke by stiffening arteries and thickening the blood. But the benefits of quitting begin within days and continue for years. Alcohol intake should be limited or avoided, since heavy drinking destabilizes blood pressure and weakens vessel walls. Weight control and blood sugar management are also essential, especially for those with diabetes, which accelerates atherosclerosis and multiplies stroke risk. Regular medical checkups are another layer of defense. Older adults should not wait until symptoms appear. Scheduled visits with physicians allow early detection of silent threats such as arrhythmias, high cholesterol, or small vessel disease. Treating these problems before they advance can prevent catastrophe. Preventive screenings, medication adjustments, and professional guidance all add years of healthier living. Emotional health must not be ignored. Chronic stress raises blood pressure and promotes unhealthy coping behaviors, while loneliness and isolation increase the risk of depression and poor self-care. Seniors should maintain social connections, participate in community activities, and practice stress reduction techniques such as meditation, breathing exercises, or hobbies that bring joy. Adequate sleep also supports vascular health, as the body repairs itself during rest. In summary, preventing stroke in the elderly requires a holistic approach. It is about protecting vessels through diet, exercise, and medication, eliminating toxins like tobacco and excess alcohol, controlling underlying conditions such as hypertension and diabetes, and nurturing both emotional well-being and social support. Stroke is not inevitable with aging. By acting early and consistently, seniors can reduce their risk dramatically, preserving their independence, memory, and quality of life for years to come. Prevention is not a single act, but a lifelong commitment. And every step taken today is an investment in a stronger tomorrow. Doctor's final words. As a brain doctor, my final message to you is simple. Stroke is not just a risk that comes with aging. It is a predictable event that strikes when silent warning signs and dangerous habits are ignored. Too many lives are lost, and too many families are left caring for loved ones who can no longer speak, walk, or live independently, all because the early opportunities for prevention were missed. The hopeful truth is that stroke can be prevented in many cases. The choices you make today about diet, exercise, blood pressure control, and medical care directly shape your future health. Quitting smoking, limiting alcohol, maintaining healthy weight, and managing diabetes or heart disease are not just recommendations. They are shields that protect your brain. Recognizing warning signs and responding without delay can save both life and independence. Never assume that dizziness, slurred speech, or numbness will simply pass. Each of these may be the brain's urgent cry for help. Act immediately. Call for emergency care. And give yourself the best chance of survival and recovery. Prevention is also about consistency. Regular checkups, steady routines, and healthy living build resilience over time. Even small steps matter. Choosing vegetables instead of fried food, walking for half an hour instead of sitting all day, going to bed on time instead of staying up late. All of these small daily acts add up to powerful protection. My advice is not given to frighten you, but to empower you. Stroke can take everything in an instant, but prevention gives you the chance to enjoy more years of clarity, independence, and dignity. Before we close, I invite you to share your experiences in the comments. Have you or someone you love faced high blood pressure, diabetes, or sudden stroke symptoms? Your story may inspire others to act before it is too late. Remember, stroke is not destiny. With awareness, vigilance, and daily effort, you can protect your brain and preserve the life you value. The decision is in your hands, and the time to act is now.